How accurate is the prostate-specific antigen, PSA test? Imagine a simple blood test that could help catch prostate issues early. That's what the prostate-specific antigen test aims to do. But how reliable is it really? Let's find out. The PSA test measures the level of prostate-specific antigen, a protein made by the prostate gland, in your blood. If the level is high, it might mean prostate cancer. But it can also be caused by other things like benign prostate enlargement, inflammation, or infection. So it's not a perfect indicator of cancer. The test is quite sensitive, meaning it can detect elevated PSA levels in many men who do have prostate cancer. About 85 to 90% of men with prostate cancer will have a positive PSA test. That's good for catching some cases early. However, the test's specificity is lower, often between 33 and 49%. This means many men without cancer might have elevated PSA levels, leading to false alarms. False positives are common. Around 6 to 7% of men tested will have a positive PSA result that's not due to cancer. And only about 1 in 4 men with an elevated PSA who undergo a biopsy will actually be diagnosed with prostate cancer. That means many men might go through unnecessary biopsies, which can cause discomfort, bleeding, or infection. For men in the general X age group, who are now reaching the age where prostate screening becomes relevant, this is important. They tend to prefer health decisions based on facts and want to avoid unnecessary procedures. The limitations of the PSA test fit into this mindset, especially since treatment for prostate cancer can sometimes lead to side effects like sexual dysfunction or urinary issues. To improve accuracy, doctors sometimes look at other factors like age-specific PSA ranges, PSA density, or the percentage of free PSA in the blood. These tools can help interpret the results better but don't eliminate the test's flaws. In summary, the PSA test can help find prostate cancer early, but it's not foolproof. It often produces false alarms, leading to unnecessary procedures. Men in Generation X usually weigh these risks carefully, discussing with their healthcare providers whether screening makes sense for their personal health. They consider their family history, overall risk, and personal values before making a decision. The goal is to stay informed and make choices that fit their lifestyle and health priorities.